Hello, welcome to the People's Campaign for Preventing Chronic Pain. I'm James Frickton. We had such a positive response to the online course from Coursera on preventing chronic pain that we decided to try to broaden the impact and develop the People's Campaign for Preventing Chronic Pain. We're kicking off the campaign this week on Indiegogo at this address above. The goals of the campaign are: 1, to promote education on preventing chronic pain. We are developing toolkits for health professionals, employers, and individuals to learn the basics of preventing chronic pain and alleviating chronic pain. In addition, we want to promote research in preventing chronic pain. We're developing research toolkits to develop a chronic pain research network that connects health professionals and patients, to test new treatments and evaluate new patient tools. Our third goal is to promote advocacy for preventing chronic pain. We're developing media toolkits to promote this. We believe that as much effort and resources should focus on preventing chronic pain as treating chronic pain. We'd like to engage businesses, health plans, governments, and communities in doing so. Now, as part of the Indiegogo campaign, there are perks for those who contribute. And these perks involve toolkits to learn how to prevent chronic pain. There's individual toolkits for personal use by you or somebody you care about. There's health professional toolkits for use by patients to learn how to prevent chronic pain as part of their care. And there's employer toolkits for use by employees to learn how to prevent chronic pain in the workplace. So what's in a toolkit? There's information at preventingchronicpain.org, but here's a brief summary of it. It's important to know yourself, as Socrates stated. So an individual toolkits help you know yourself. It's an online pain and risk assessment with goal setting, and it allows personalized online trainings with videos that are based on the results of your individual risk assessment. We provide experiential handouts, a preventing chronic pain manual, as well as in-person seminars, access to online stores for pain-preventing tools, as well as access to a health coach if you need one. Now, this individual toolkit is also available for health professionals. This toolkit includes 10 individual toolkits just to try out. It also includes an implementation plan for an outpatient clinic, marketing resources and outcomes assessment, an in-person health professional continuing medical or dental education course, as well as participate in the Chronic Pain Research Network. We've also developed employer toolkits. This also includes 10 individual toolkits, as well as an implementation plan for the workplace, marketing resources, an outcomes assessment, and an in-person employer course to implement in the workplace. So what's in the training? Well, the principles behind the Coursera course on preventing chronic pain will be carried over into the toolkits. The idea is to reduce risk factors and strengthen protective factors. The protective principle is if you have an injury and you develop acute pain, when you have a lot of protective factors such as exercise and good posture, eating well and sleeping well, you'll develop normal healing and no chronic pain. However, the risk principle plays a role in many cases. If you have an injury and acute pain and you have lots of risk factors such as stress, poor sleep, eating poorly, no exercise, you will delay in healing and develop chronic pain. So preventing chronic pain involves strengthening the protective factors and reducing risk factors. We also agree with Benjamin Franklin, an ounce of prevention is worth a pound of cure. And these risk factors and protective factors occur in all areas of our lives. As you can see here, the body, lifestyle factors, emotional factors, our spiritual sense, our society or the people and relationships around us, our mind, the thoughts and attitudes we experience, and the physical environment around you and how we interact with it. Each of these can have specific risk and protective factors that we can encourage or try to reduce. So let's shift the focus to you. So what's a toolkit in it for you? You have to decide, who are you? The toolkits will allow you to take a selfie in all 7 realms of your life. So your mind, what are you thinking? This course will cover preventing chronic pain by improving understanding, realistic expectations, clear planning, self-efficacy, and coping with the ups and downs. Your spirit, what drives you? Preventing chronic pain by enhancing love of life, enthusiasm and passion, managing stress and burnout, gaining self-awareness and insight, defining your purpose and direction, building hope, and using tools such as meditation and prayer to do so. And your body, what's happening within your body? Preventing chronic pain with exercise to improve strain and tension, balance, relaxed posture, improve range of motion, gain strength, agility, balance, and improve fitness are all part of the toolkits. What about your lifestyle? What do you do each day? Does it protect you from chronic pain, or does it enhance or encourage chronic pain? We will help you improve sleep, use a pain-preventing diet, improve pacing skills, achieve high energy without chemicals. And your emotions, very much tied into chronic pain. How do you feel? We will prevent chronic pain by helping you develop creative strategies to manage anxiety with calm, depression with joy, fear with courage, and anger with contentment. And your social life is also very important. What is the quality of the relationships you have? Does it support healing and recovery, or decrease it? We will work with you on developing how do you receive and provide good social support? How do you maintain positive relationships and resolving conflicts amiably? How do you reward recovery and avoid disability and secondary gain? And then your environment. What surrounds you that might cause chronic pain or injury or protect you from it? We will help you do an environmental scan to develop a clean, organized, and safe environment that protects you from chronic pain with low risk daily activities and low risk of injury, infection, or adverse events. So the training also blends evidence-based science into the course, but it does sprinkle a lot of common sense in it. We also really believe strongly in experiential learning. I hear and I forget, I see and I remember, I do and I understand, says Confucius. This is the way we best learn. So many of the participants in the online course believe very strongly that the course was a positive influence on their lives and their care of patients. 93% said it changed their life. 85% of health professionals changed the care for their patients. The comments were excellent, and you can read some of these comments here. We want to carry the same philosophy and quality to the toolkits, which each of you can have your own individual toolkits through the Indiegogo campaign. So get a toolkit for preventing chronic pain now. And so the question comes up, what part do you want to play? Well, some people state, I'd rather be a huge part of the problem than a tiny part of the solution. But instead, we want you to be a big part of the solution. Only you can change healthcare. So please support the People's Campaign. Thank you very much.